family, friends, I am in the office of Kendra Holmes, St. Louis finest. She is a woman that is amazing. She's doing amazing things in the city. She has an amazing story, journey, and future. I am so excited to be in this building. Miss Kendra Holmes, how are you doing today?
I am fabulous. How are you?
I am doing amazing. Amazing. It's amazing to be in your space.
Really?
It is. You don't understand because I like personal interviews. I do a couple, virtual. That's fine. But the personal interviews, to come in the space, to feel your energy is amazing.
Awesome.
See your staff, your assistant. She's amazing.
We are good people here.
Absolutely. I see. So what I want to do is I wanted to interview you and bring you on this platform because I wanted to not just men, but everybody. I want them to know how your journey to get to where you are now. Because right now, during the season and what we're going through right now, you are blossoming.
Well, thank you.
I mean, we see it online, we know, but you were already there in that spotlight years prior. But now it's going to take you and shoot you to a whole nother dimension, and we want to showcase that because we're gonna come back.
Okay, we're gonna come back.
But why don't you share with me, your upbringing, and you can just tell your. I want you to tell your story from childhood to where you are now, and the pillars and the things that you have accomplished over the years.
Well, I think first I'll just say I've just been incredibly blessed. That's where I think I have to start with. So I am born and raised in St. Louis. I am so St. Louis. This is my home. This is good, bad, and ugly. This is my home, and this is the place that I love. So I grew up in North St. Louis.
Okay.
Had an amazingly supportive family. Went to Metro High School. The best high school in the state of Missouri, I might add. So had a great education at Metro. Decided that I wanted to go to pharmacy school.
Mm-hmm.
Pharmacy wasn't my first pick. I actually am a American history lover. So I love the Civil War, American history, that type of thing. But also had a lot of interest in science and chemistry. So went to St. Louis College of Pharmacy, fell in love with the school, and then my pharmacy career just kind of took off after that. I knew that I wanted to work in an underserved community. So when the opportunity came to work then it was Grace Hill Health Centers. When that opportunity came up, I jumped at being a staff pharmacist at Grace Hill Health Center. Now, of course, is Affinia Healthcare. It was definitely in the hood.
Right.
Old North St. Louis, very underserved population. The pharmacy was actually in a kitchen in an old building. That's just how underserved the community in the area was. And I walked into it and I started filling prescriptions, and I knew I was not leaving anytime soon. That was the community that I wanted to put my work into and to help that community. So I stayed in that role as a staff pharmacist. Actually, not even a year. I was promoted to the director of pharmacy in less than a year. My progression in Affinia Healthcare, it has been great. I've had a lot of support, a lot of mentorship. Most recently, I was promoted to Senior Vice President, Chief Operating Officer. In that role, I oversee just about all of clinical operations: nursing, pharmacy, radiology, laboratory, homeless services, accreditation, security, facilities, just about all of the operations piece. And
sound like you run the show.
It's a team effort.
I get it.
I have a great team, and you are only as good as your team.
That's true.
And so, and then of course the pandemic came along and just really highlighted all the disparities in the African American and underserved communities. And Affinia Healthcare was just right there in the community from day one, helping to provide testing and now vaccines to the community.
Right. So let me ask you a question. If you had to empower some young lady out there that is starting her journey, not just in the health field, in any field, what kind of advice would you give her?
Well, I would say that my focus, and I will definitely mentor anyone. My focus is as African American women. So I would tell her that, you know, her blackness is a benefit. It is not a disadvantage to utilize the power and the resilience that we have as Black women to just keep pushing forward. The sky is the limit. And although you will definitely run into some obstacles and some barriers and individuals thinking that you're not worthy because you are a Black woman, just prove them wrong.
Prove them wrong. That is great advice. Now, you're a mother.
I am a mom, yes.
You are definitely when I say she's a mother, she's a mother. She makes sure she is showcasing her son. Exactly. We know. Go check her out. I'll put everything in the bottom so you can go check her out and follow her. But as a mother, being the pillar that you are, and being an African American woman, what advice would you give that mother? Because a lot of people say, well, I have a child and I just don't have time.
All right.
Or I can't do it because of this and that. Give a little bit advice, or give a little bit encouragement for that person.
So I would say that being a mother has made me more efficient. Being a mother, I don't have the privilege of not getting things done. So, if there's a science test, if there's, a project that's due, I have to stay, on that schedule. I have to get things done because ultimately my primary priority is my child. Work is very important to me, but when it comes down to it, it's always going to be my child. So I think that, you have to have a schedule. You have to, really plan things out. And notice that, there's going to be opportunities for work-life balance, and to know when you need a break. That's very important.
Okay. We love it. Now, right now, we know we're in a pandemic. We know that everything's going on. So currently, what are you doing in the city? Just let the people know, because I want this moment, this time to be remembered, and remember that you were one of the pillars on the front line.
So testing continues. So COVID-19 testing is still necessary. What we're doing right now is we're doing vaccinations. So we're doing vaccinations. We're following the Missouri distribution plan, but we're prioritizing those who are most at risk. So senior citizens, those who have cardiovascular disease or underlying conditions, we are encouraging them to get the vaccine. Now, in the African American community and underserved communities in general, there's a lot of distrust in the vaccine, a lot of distrust in the medical system, and there is absolute rationale for that distrust because the healthcare system has not been kind to Black people. So it's a lot of education that we're doing. It's a lot of education, a lot of acknowledging the harms that have been done to Black people in the medical field, and then just encouraging the vaccine, because Black people are dying from COVID-19, and that's just the facts. That's not rhetoric. That's not politics. The numbers don't lie. So we really need to encourage our communities to get this vaccine.
Thank you. Well, Ms. Kendra Holmes, we salute the divinity in you, and we thank you for being on our platform, Think Smart TV, and please continue at what you're doing, because I believe women across America, women in the state of Missouri, women in the city of St. Louis, and all of our areas, they're going to look at you and say, I want to be similar. Not be you, but be similar.
Be better than me.
There you go.
Be
better than you as they move forward in their careers. Thank you. And we salute the divinity in you. Thank you.
Thank you.